Good afternoon. At this time, it's my honor to present Dr. Wilmore Webley, Professor of Microbiology and Senior Vice Provost for Equity and Inclusion at the University of Massachusetts Amherst. His research integrates innovation and public health with a focus on chlamydia infections, including investigations of pathogen-host interactions and the development of novel vaccine delivery strategies. In addition to his scientific work, Dr. Webley has been a trusted public voice, delivering nearly 200 presentations during the COVID-19 pandemic through interviews, live broadcasts, and media engagement to provide clear, science-based guidance on vaccine safety and public health. Dr. Webley, the floor is yours.
Thank you very much. Thank you to Kevin for putting all of this together. Thank you very much for giving me the opportunity to be a part of it. Thank you, Dr. Schaffner, for your great words of how to communicate effectively and how to actually reach the patients. Kevin asked me to speak a little bit about measles after 50 years. I kind of took that a little bit longer and went into a little bit more timeline for context. But this picture always catch my attention. And it's an image of around 1492 of Native Americans. They're gathering in the New Mexico area. And when you see the diversity, the numbers of people, it's estimated that there probably were around 60 million people in those times of Native tribal Indians, especially as they came to these ceremonial areas. And it is thought that as the Europeans colonized the Americas during that time, that a combination of smallpox and, of course, measles was responsible for killing the vast majority of those individuals who were naive to this disease because they had never encountered it before, they'd never seen it before. And so the estimate is that it is likely that measles has been in the human population for about 5,000 years now. And measles appear to have been a descendant of the cattle virus that we call rinderpest virus, based on its structure, based on sequencing that has been done. But needless to say, measles has been around for a very long time. And I have a few timeline historical charts for you on measles, and they emphasize different things. For this one, it's going to emphasizing when measles got fully established in the human population, somewhere around 3,000 years ago. And that coincides with humans starting having more close interactions with animals, but also living in more communal settings with lots more people around. And measles did not seem to go global until it entered the Americas in the 15th century with, again, the immigration of Europeans. And of course, along with the smallpox infections, the people believed that this facilitated the conquest of Native American civilizations, causing these large number of deaths that I talked about. And you'll see there that we have measles vaccine introduction in 1963. I'll talk a little bit more about that. And some important discoveries in the 1980s, one of which was that it was discovered that especially for people in areas where they're malnourished, actually having vitamin A would be very helpful. And we've heard a lot about vitamin A recently in measles. It should be noted that it was a supplementation for nutrition and not for prevention of measles, but rather for getting the patient through the illness. And then, of course, the reductions that we saw in measles cases and in the rise in measles cases. So if we step back around 86, Abu Bakr actually described in writings the eruptions that they saw on the skin that weren't smallpox. And it is believed that that was measles. And then, of course, Razi's in the medical records describe these measles rashes that we've become used to. And then Francis Home theorized in 1757 that measles was caused by an infectious agent. And after that, in the late 18th century, the complications caused by measles were recorded in the medical literature. And then Peter Panum recorded very nicely the transmission of measles, that measles could be transmitted from one person to the next. And they saw that on the Fire Island outbreaks that were pretty devastating. But what he also found was that if you got infected with measles and you survived, that there was lifelong immunity, and that became important later on. And then Hecton in 1905 noted that measles transmission in humans could actually happen when you use bacteria-free blood, essentially filtered it, and used that as an inoculum to determine if the person could still get measles. In other words, that filtrate, that filterable thing, because at that time bacteria were known, but viruses weren't as well known. And then Clement Paquette reported the immunosuppression that measles caused. Very early on in 1911, saw that patients who got the tuberculin vaccine, if they had measles, it suppressed the effects of that in the acute phases of measles. It would take many, many years later for us to actually confirm that. And then James Dawson described the subacute sclerosing panencephalitis that measles is known for in many of the cases. And then came some really important findings where in 1954, the virus itself was isolated by Enders and Peebles, and Enders actually went on to use this isolate from David Edmonston, called the Edmonton strain, to create the first licensed measles vaccine in the United States in 1963. So as we look at the development of the vaccine in 1964, the Edmonton strain B was licensed. And then you saw in 71, the MMR vaccine, the combination, was licensed. But you notice that this was strain A. And this makes it easier to determine if somebody's been vaccinated, since you can actually determine the strain. And then in 1977, the schedule for the vaccine was changed to a one-dose schedule, and you'll realize that they went back on that in 2000 to go back to a two-dose schedule. They felt that that was a better vaccine. In 2010, 2011, the receptors that the measles virus used to enter cells was finally confirmed that it used SLAN. Initially, the studies were being done using the vaccine strain, and so they had mistaken what the receptors were. And then between 2012 to 2019, a lot of work was done on measles immune amnesia. The idea that the measles virus, when it infects you, it wipes out your immunity to anything else that you've been infected, you had been vaccinated and protected from for a long time. And sometimes it could take up to 3 years before you actually get fully vaccinated against things that you had seen before. And then we started seeing a resurgence in measles after measles was declared eradicated pretty much in the United States in 2000. We started seeing this upsurge in measles between 2014 to 2019. In 2019, we had a massive outbreak of measles. You remember in New York City and other places. You also remember earlier the Disneyland outbreaks. And the WHO listed this vaccine hesitancy as one of the top 10 challenges, because it was thought that one of the things that was going on here was vaccine hesitancy was actually leading to measles outbreak. Fast forward to 2025, and we've seen the largest outbreak of measles we've seen since it was declared eradicated in the United States. And we're just halfway through the year. Now, measles had always had this kind of pattern, this temporal pattern, when you look at the epidemiology, because it's so contagious. We'll talk a little bit about that. And as new people are born, new susceptible individuals, the numbers of measles infections would go up. But then after the vaccine started being used and widespread, you can see in the late 1960s, you can see that the threshold actually drops, even though you still had a similar pattern. The numbers of people being infected per 1,000 actually dropped significantly, showing the effect of vaccination. And then, of course, the important thing here that you had the vaccine license in 1963, as I said, but then measles was eliminated essentially in the United States in 2000. It was declared eliminated. And then we got to this year, starting last year. And at the last count, we were up above 1375 as the measles outbreak started in the Mennonite population in Texas and expanded to New Mexico, then across the border into Mexico. In Chihuahua, Mexico, the case counts went up really, really significantly. We saw cases in Canada as well, and there seems to be a fault line, a link there. And many other states had outbreaks, and some had sporadic cases of measles, because measles is very contagious, and all it requires is to find a susceptible group of people, which it found in this population that's pretty much closed off, do not get vaccinated, but traveling groups, makes it very, very easy to get infected. So you can see from 2000 to 2025, 2019 was an unusual year with that huge outbreak, but you can see that in 2025, we've already surpassed that. Now, measles, as I said, is very contagious. It is estimated that one infected measles patient could infect another 12 to 18 people easily. That's way more than influenza, Ebola, or even mumps that people think about. It is thought that if you were in a space 2 hours after a measles infected person was in there coughing or just simply breathing, you could become infected with the measles virus. And so when we look at the period of infectivity, the period of contagious measles infection, you can see that that's anywhere up to about 22 or so days from the time that you get infected. And you can see here that depending on the dose of the infection, you can have different timelines there. But essentially, you have a 2-week, 2.5-week incubation period with very little to no symptoms. After that, you have this prodromal period where you have fever, you have cough, malaise, conjunctivitis many times set in. And then rash comes in somewhere right after that. Within a week or two after that, you start having rash. And then they subside for the patients who are going to recover from this. The symptoms fade, the virus lingers for a little bit, but then you have immunity because the immune cells kick in. But when we look at the diseases, the conditions, the usual course of the illness, where, as I said, you start having those flu-like almost symptoms, and then you start having Koplik spots, those tiny white spots that may appear inside of the mouth. Doctors will check for that. And within 3 to 5 days after the symptoms begin, you could start having rash in different parts of the body. But then you could get some more unusual symptoms. Some patients, 1 in 1,000 patients will get encephalitis. Some patients get ear infection. 1 in 10 children will get ear infections. 1 in 20 children will get a pneumonia, severe enough pneumonia that they end up in the hospital, or this is what typically leads to death. 1 in every 1,000 children who get measles could end up dying. You could also have diarrhea. In 8% of the recorded measles cases, there has been diarrhea. And so essentially then, measles is a formidable viral infection that can lead to several different sequelae, from otitis media to diarrhea that can last for a while to conjunctivitis. These rashes are a good sign that you have that. Measles virus actually is able to infect immune cells, which means that it's knocking at the very protection that you would typically have throughout the body. And measles encephalitis, of course, can lead to seizures, comes after high fever. So that is always something that one is thinking about. For those of you who are interested in the biology of the virus, it has a hemagglutinin protein that's very similar to the flu virus, hemagglutinin protein coming through the lipid bilayer on the surface. And then it has a fusion protein. You use the hemagglutinin protein to actually enter the cells, to bind to the receptors on the cell. And then it used the fusion protein to actually fuse the membrane so that it can allow its nucleic acid, RNA, to enter the cell. And using the RNA-directed RNA polymerase, it replicates its genome and make the proteins that are needed, everything from its matrix structural proteins and nucleoproteins to accessory proteins that it used to infect and to maintain itself within the cell. So the measles virus typically enters through the lungs. Once it gets in, it's typically picked up by macrophages and dendritic cells. These are what we call antigen-presenting cells. So they're migratory. And the virus uses that fact because it infects these cells. These cells typically can't get rid of it, so it replicates very rapidly within these cells and then leave the lungs and can go into other organs through the lymphatic system. It can get into lymph nodes and gets transmitted around the body in that way. It can end up in the spleen. And a part of what you see in terms of a rash is actually the virus entering into blood vessels and other areas in the extremities. It enters the cell through a receptor called SLAM, which is also called CD150. SLAM is signaling lymphocytic activation molecule that pretty much all your immune cells have on. And they upregulate that receptor when they get infected. Endothelial cells, neurons also have these receptors on it. In other words, there are a lot of cells in our body that are susceptible to the measles virus. So no wonder it is so contagious, because it can replicate at high numbers because it is found in so many different cells. And so again, in the early infection, the virus enters the body, and as you progress through a couple of weeks to a week and a half, you get these rashes. You get the early signs of it, and then you have recovery, but then you have immune cell depletion, as I said, and the measles virus can infect 20 to 70% of memory cells. These are the cells that are in your body after you've had an infection that are your rapid response responders. Your memory B cells go on to make plasma cells that pour out antibodies if you ever see the same entity again. Your memory T cells also are there to easily help your B cells by providing cytokine and chemokine help. And measles actually prefer these cells because they have strong receptors. So in measles amnesia, it's one of the interesting features of the measles infection, where studies in humans and non-human primates have revealed that it actually replaces the old memory cells. It kills off those memory cells by infecting them, but replaces them with measles virus specific lymphocytes and memory cells. And as a result of that, the patient comes out of this not having protection against common pathogens that they had been exposed to and had built an immune response to. And as I hinted before, it can take up to 2 to 3 years post-measles infection to actually get back that level of protection. And sometimes revaccination, especially when measles has infected a young adult or an older adult, sometimes you might need to go back and get revaccinated for the stuff that you had before. This interesting study was done in the UK where they showed that right after a measles infection, the number of people who had measles who come in for prescriptions for other infectious diseases actually goes up significantly. And then you can see that it trails off. So it's infected with measles versus the pink line uninfected, and you can see that spike after. In other words, you're left vulnerable by the measles infection, so you get infected with other things. So how does one control a measles outbreak when you have an outbreak like the one we just experienced here in the United States? Well, there are clear public health guidelines on how to do that, where isolation, quarantine, vaccination. If one is vaccinated, of course, it protects you from the infection. The MMR vaccine is the vaccine of choice for that. But in this model, you can see that if you're doing both isolation, quarantine, and vaccination, that you can actually significantly reduce the probability of measles transmission up to about 85%. And so when we look at the global number of infants vaccinated against measles, we're seeing an interesting trend. The total number of 1-year-olds being here, this is from our world data. And then you see those vaccinated against measles, and you see that something happened somewhere around the late 1990s that kind of dropped that number. And then you can see that in the late 2017, 2018, you can see that number drop again. So what is accounting for that drop that we see in the late 1990s? That came from a paper published in the Lancet by Andrew Wakefield, where if you look at the title, you would never think this had anything to do with measles. The paper was later retracted, but way too long. In fact, the biggest mistake made with this paper was that it ever got past reviewers and got published, because it was really a poorly written paper, and what passed for a study was really measly. Eventually, most of the authors took their names off, as most of the co-authors took their names off. And you can see here, this study had more authors than it had patients in the study. But Andrew Wakefield, a physician in the UK, well-spoken, very charismatic, published this paper. And essentially what the paper claimed was that vaccination with the MMR vaccine, vaccine of choice for measles, mumps, and rubella, led to kids having autism. And this study had 12 children. It had no control group. So he failed to have a control group with children who were unvaccinated in there. And in the UK, vaccination rate for measles was above 90%. So the vast majority of kids got the MMR vaccine anyway. And autism symptoms, as we know, typically emerge right around the same time that you actually have the measles vaccine. And then it became clear later that the biopsy tissues and the gastrointestinal issues that the kids were having, the biopsies that he took, suggested that they had these after they'd gotten the measles shot. But it turns out that data showed that a lot of these kids had autism symptoms before they ever got the MMR vaccine. And when one look at the claim that he's making from this, that the MMR vaccine at the time, he said that it was the combination, that you needed to separate the vaccines. He didn't reveal that was advising a competing company and getting compensated for it to have an alternative to the MMR vaccine. But essentially, what he had was a really tiny group of children, many of whom he recruited at one of his kids' birthday parties from the literature. And this group of 12 children could not give you what we call in statistics the statistical power to make any sweeping conclusions from it. However, with all the issues with this study, this thing caught on like wildfire. The Lancet published that paper. It went all throughout the country, went abroad in the United States here. Many people picked it up. Andrew Wakefield, after losing his license in the UK, literally took up residence here in the United States, where he found many supporters of this myth that the MMR vaccine was linked to autism. Now, in the aftermath of that, many other studies found that there was no link. His study was published in 1998. Almost immediately, a study came out in 1999 looking at 500 children, way more than he ever looked at, finding no link. Then there was another study in 2001 with 10,000 children. Then the Danish study with over 500,000 children. Then there was another study from Finland with another 500,000 children. Then there was another study in 2004 refuting these claims, showing that he falsified data. And so essentially, there were studies after studies after studies that showed that there was no link between the MMR vaccine and autism. But look at the data from the UK. You can see the vaccination rate above 90%, right around 91%. It started dropping a little bit before Wakefield's paper. And then it plummeted for many, many years after. And so measles cases went up significantly. It was a similar trend in the US, where MMR vaccine uptake plummeted after that paper came out, dropping precipitously before we started seeing a rise again. So the effect of this misinformation and disinformation based on Dr. Schachtner's presentation really resonated with people. And when you look at study after study, the Wakefield study in 1998, he actually came and followed up in 2002 with another study that was also retracted. And study after study refuted the MMR autism link, but it didn't seem to matter much to people. When you look at the studies overall, you can see here in yellow, these are people who are unvaccinated with MMR vaccine, versus the blue, those who are vaccinated. And you look at the rate of autism, you can see that overall, the rate of autism continued to increase, but it actually increased more significantly. Well, it wasn't statistically significant, but it was a higher number in those who were unvaccinated versus those who were vaccinated, when you look at the overall numbers. And when you actually look at the risk factors for autism, vaccine is not in there. So we know that smoking is a risk factor for autism. We know that premature birth is a factor. We know that older paternal age, above 40 years old, significantly increases the risk of having an autistic child. Same thing for the mother, age over 35. And when you actually look at the data carefully, like in the United States here, you'll see that autism spectrum disorders are linked to gender. Male children are way more likely to have autism spectrum disorder. And even by state, if you live in Alabama, you're way less likely to have an autistic child than if you live in New Jersey. And the question is, why are these things happening? Is there some environmental factor that's going on? These studies have not reached the level that they could have because of the distraction of having to prove and disprove this autism MMR vaccine link. And so here I've listed the major studies that have been published over the years, including a 2019 study that had over 600,000 participants from Denmark. It turns out that millions of people have been tested to disprove this study that had 12 children, and we still can't seem to get a handle on it. But what is the reality? The reality is that measles vaccine actually saved lives. It's estimated that 94 million lives have been saved since 1974 by the measles vaccine globally. You can see that the number of lives saved here for measles is way higher than any of the other vaccines listed here because of the contagiousness of measles and the importance of vaccinating. You can also see that before vaccination, people say the vaccines actually work. Well, before the polio vaccine, as you can see, you had significant amounts of infections. After vaccination, that number significantly dropped. The same thing for polio vaccine. After the vaccine, the number of polio cases plummeted to almost nothing. We see the same thing with measles, that after the measles vaccine was introduced, the number of measles cases actually plummeted. And if you really want to talk about, the challenge and risk, when we look at the risk of getting a measles vaccine, one can have rare side effects. 1 in 40,000 vaccinated children can have an ITP after a measles vaccine. We've seen a few cases of spasms after vaccine. We can see people with skin rash or fever, about 2 times more likely after vaccination. But what are the counter to that? The counter to that is that the positive effects. 1 dose gives a 95% lower risk. That's a 20 times lower risk. With 2 doses, 25 times lower risk of getting measles. After being exposed to someone infected by measles, if you get vaccinated, it lowers your risk by 7 times of actually getting the disease. Children who were vaccinated had a slightly lower rate of Crohn's disease as well. Children who received the vaccine have a lower rate of pneumonia. So the risk of getting vaccinated is way lower than not getting vaccinated. When we look across the United States, we can see that there's a significant reduction in every single state as you start looking out, especially in the late 1980s to 1990s over into 2000s, significant lower numbers of measles. And when you look at protection, this simulation is showing you that if you have a threshold of people vaccinated in a community, there's a significant herd immunity protection to that community for those who are vulnerable and have not yet gotten vaccinated. Those below a 1-year-old, for example, are those who have other conditions that prevent them from being vaccinated. There are people like that in our communities. But measles is so contagious that you need that vaccination rate well above 90%. In fact, at about 95% is where you actually start seeing that you actually have that level of protection. And there's a simulator called Fred Simulator here. And this is my county, Hampden County, here in Massachusetts. And what I'm showing is that if you have 80% of people vaccinated, even with 80% vaccinated, and 1 case of measles introduced, you can see that it's running the gamut in the I-91 corridor in the county. You're seeing a significant uptick over the same period of time versus 95% coverage. You're seeing that you're having little to no activity. So getting vaccinated and having a critical mass of the people in the population vaccinated is really important. You can scan this QR code if you want to put in your favorite city or county into this Fred simulator, so you can simulate what a measles outbreak might look like in your specific county, in your area. Now, when we look across the country, you can see the differential coverage for kindergartners by state. States that are more orange here have less than 90% protection. Remember, I said that it requires about 95% to protect via herd immunity. And then those above 95% are in blue. So you can see your state there. You can get this data at CDC. We've also heard repeatedly now that you don't need to get vaccinated. You just need to take vitamin A. And what we've seen happen in Texas over the period of this year is that we've seen kids actually showing up to the hospital with vitamin A toxicity. Yes, it turns out that taking too much vitamin A can lead to some liver damage and vitamin A toxicity. Vitamin A, as the WHO found out, is effective in areas where there is a lower nutritional support, where there's malnutrition. But in the United States and developed countries, most people get the vitamin A that they need from the foods that they eat. And some people take supplements, so there's no need to have additional vitamin A supplement. Moreover, vitamin A, while it might help with fighting the disease, does not prevent you from getting infected. And that's really important. So the current vaccination rates aren't enough globally, 74% vaccinated and 66% for lower income countries for various reasons. So we will continue to see measles outbreaks. But again, when you look at the cumulative lives saved in various regions of the world from Africa to the Americas to Europe, you can see that the measles vaccine has been extremely effective. When you look at measles death per region, you can see them falling precipitously over the years from 1980 onwards as the measles vaccine has been deployed in every region of the world. We're seeing this. So the reasons to vaccinate is that we're choosing facts over fear. That for all of these vaccines, they've been very effective. So choose facts over fear is the message. And I'll just reiterate what Kevin started out with so eloquently, that over the past 50 years, we've seen measles vaccine get licensed. We've seen it result in a dramatic reduction in measles cases, measles deaths, measles infection. Measles was declared eliminated in the United States in the year 2000. But what we've seen that as a harbinger of Andrew Wakefield's work and other anti-vaccine movements that have gotten fresh energy and fuel from social media and other quarters. We've seen a link with political ideology and anti-vaccine sentiments, and we've seen a resurgence in many infectious diseases. But measles is typically the canary in the coal mine because it's so contagious. It tells you the trend that we're seeing. And people have suffered severe health consequences. We saw 2 children die because of measles this year. We've seen people's lives get significantly upended because of it. The people who didn't die, some of them are left with hearing issues. Some of them are left with long-term respiratory and inflammatory issues. And just yesterday, we saw the director of the CDC fired over, as we're hearing now, refusing to resign after she was asked to rubber stamp unscientific, reckless policies around vaccine. We see lifelong public health professionals who have given their lives and their time to the CDC, resigning in protest rather than going along with something that's unscientific. And people might not understand this, but as a scientist, your integrity as a scientist is very important. That's what you live and die by. And so trying to get a scientist to rubber stamp something that we know to be false is certainly a bridge too far, and that is what we're seeing. So as a country, as a nation, as a world, we really have to get a handle on misinformation and disinformation because it can lead to death. And so the bottom line is that measles remain a highly contagious infectious disease, but the MMR vaccine is an effective vaccine to prevent measles, to prevent mumps, to prevent rubella. And the fact remains that the MMR vaccines do not cause autism. And I will stop there. Thank you.